that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? For African American men, that rate is even higher. And here to talk about your risk, the importance of screening, and new treatment options is Dr. Julian Anthony, urologic surgeon with Palomar Health. Welcome.
Thank you for having me. I'm glad to be here.
Doctor, we know that prostate cancer is the second most common cancer in men. Who is most at risk?
Yeah, so prostate cancer is a disease that tends to affect men as they age. Aging is one of the risk factors. We've also found that certain races are more predisposed to prostate cancer than others. So African American men have a higher risk of developing prostate cancer, and when they do, they develop a more aggressive form of the disease.
And traditionally, are there any signs or symptoms to look out for?
So what's really concerning is that in the majority of cases, there are no signs or symptoms, but things that can be associated or that may lead to workup and evaluation for prostate cancer are a lot of urinary symptoms. So changes in the urinary stream, frequency of blood in the urine, bone pain is also a sign or symptom of more advanced disease.
And since many men don't experience those symptoms, that's why screening is so important. Tell us how screening is done for prostate cancer.
Exactly. Screening is very important for prostate cancer. It helps us detect the disease earlier when we have more treatment options. Screening is simple and consists of two things. It consists of a digital rectal exam where we actually feel the prostate for any abnormalities, and a blood test called PSA, which stands for prostate specific antigen. Literally something that takes 10 to 15 seconds can really have a great impact and save your life.
And with early diagnosis, there are a range of treatment options. Tell us about them.
Absolutely. So for prostate cancers that are detected early, we refer to those as localized prostate cancer. You have observation as a treatment option where you don't actually treat the cancer, but you keep a close eye on the cancer. And that's usually best for the less aggressive, lower grade prostate cancer. And then other treatment options include radiation therapy to the prostate. And the last treatment option would consist of a removal of the prostate, which we can do in a minimally invasive fashion. We do that robotically.
And Palomar Health is using advanced technology and robotic surgery to offer patients new advantages and better outcomes. Why is it becoming a popular and requested treatment option for prostate cancer?
Robotic surgery has become a more popular treatment option because of the decreased risk and side effects involved. It really minimizes complications, urinary leakage, erectile dysfunction, bleeding, and longer hospital course. When we go in laparoscopically through tiny holes and are really in a minimally invasive fashion removing the prostate, we're able to really minimize those risks so that we rarely are having to give patients blood for transfusions. It's the standard of care now that patients undergoing prostatectomy go home the same day, and they return to work quicker. They get their Foley catheters out quicker, and tend to have less complications or issues with urinary leakage afterwards and erectile dysfunction.
And are there other urologic cancers that can benefit from this minimally invasive robotic approach?
Absolutely. Pretty much all of the malignancies that we treat in urology can be approached in a minimally invasive fashion. We treat kidney cancers, cancers of the ureter, and cancers of the bladder as well.
To learn more about robotic surgery and advanced treatment options, visit palomarhealth.org. We'll see you next time.